Today I'll be talking about hip replacement surgeries. Now, hip arthritis is a very disabling condition. It is not very common in the Indian community. It is a little more common in the Western population, but it does happen in the Indian community. It could be, causes might be age related, what we call as avascular necrosis, post-injury, post-infection. There are various causes, but when it happens, it is a very disabling condition. Patients have got a lot of pain, they are not able to walk, they are limping, and the quality of life is seriously compromised. In these cases, when there is a significant arthritis of the hip, we do perform hip replacement surgery. When we say hip replacement surgery, what do? We take a small stem and we put it inside your thigh bone, and then we put a ball onto we connect a ball onto that stem, and then we put a socket, artificial socket, and then this gets reduced, and so you've got a nice joint which is mobile in all directions. Now, hip replacement surgery needs a particular expertise because it is important to get the limb length right. Sometimes if you are not very technically sound, you might end up leaving the patient with a little limb length discrepancy. It is important to ensure proper stability of the joint. It is important to make sure that there is no injury to the surrounding nerves, and also to ensure that there is no infection that happens. There are various options in hip replacement surgery. There are ways where we can fix the stem and the cup into the bone. It is either using something called as a bone cement or another technique called uncemented. We can use metal heads, we can use ceramic heads, and off late we also have something called dual mobility. With a dual mobility hip, it also gives the opportunity to the patients to squat or sit on the floor. Now, the outcomes following hip replacement surgery are excellent. Patients are extremely grateful because it is a very disabling condition, hip arthritis, and post hip replacement they are pain-free, walking, they really start enjoying their life. So if you have a bad hip, if it is arthritic, and you don't have to live with pain, you can get it replaced and it gives you wonderful outcomes. Thank you.